Hey everybody, I'm Ron and I'm here alongside Anthony to talk to you about herbal medication safety. One important thing that people fail to realize with herbal supplements is that they may interfere with your prescription drugs and also other natural supplements you may be taking. So, the purpose of our presentation today is to give you the proper insight into these herbals, to know what questions that you need to either ask your healthcare provider or even ask yourself when you do your own personal homework. So all of our objectives are here for you all to see. First of all, we're going to discuss some of the problems surrounding your herbal supplements. Secondly, we're going to explain the safety and efficacy issues regarding herbal medications. And thirdly, we're going to review three of the most commonly used herbal medications, including their uses, drug interaction, and side effects. The three herbals we are going to go into are St. John's wort, huperzine A, and black cohosh. So herbal medications, what's the big deal? The big deal is that they're actually not regulated by the FDA, which means that the FDA is not responsible for the safety and efficacy of these herbals. So it puts more importance in your own personal self-guided study, to look and make sure that you're not taking anything you shouldn't be taking. Now, side effects. There's the biggest misconception about natural products is that they're all good and there's no bad, which is clearly not the case. There are side effects, and it is good to be aware of those, so that way, if you ever experience them, you know exactly what to do. Now, going into your drug interactions, when you take these natural supplements, your body does have to metabolize them. So what'll happen is there's enzymes present in your body, and certain enzymes are linked to certain natural substances, but they are also linked to different prescriptions. So if you're taking natural supplements and prescription supplements, or I mean, prescription medications, then they may combat for these enzymes, and there may not be enough, and that could lead to toxic effects, which could be bad. So going into our first herbal supplement, we have St. John's wort here, and it is derived from a flower. It is from Hypericum perforatum. Some of the common uses for this St. John's wort is depression, anxiety, tiredness or restlessness, loss of appetite, and insomnia. Some of the side effects you need to be aware of are increased sensitivity to sunlight, rash, satiety, which is a nice way of saying feeling full, and constipation. So the interactions, it was a little bit of what I was remembering from what I was talking about a little while ago. This specific herbal supplement goes by the route of CYP3A4. That is a specific enzyme, and or it doesn't go by route of CYP3A4. It induces 3A4. So, for example, if you're taking, say, like simvastatin, which is a cholesterol medication, that goes through the CYP3A4 route. So basically, that just means you take simvastatin and CYP3A4 metabolizes it and it leaves your body. So what St. John's wort does is it induces CYP3A4, which means that it takes simvastatin out much quicker out of your body, so you don't get the desired effect. So some other medications to be aware of, which go by CYP3A4, are your antibiotics, some of your epileptic medications, and also some of your asthma medications as well.
So next we're going to be talking about huperzine A. Huperzine A is derived from the Chinese club moss Huperzera serrata. It is used to treat Alzheimer's disease, dementia, and to improve memory. Some side effects include nausea, diarrhea, increased blood pressure, and decreased heart rate. This drug usually interacts with anticholinergic drugs, and it has been proven to be unsafe to use in patients with epilepsy or seizures, asthma, or chronic obstructive pulmonary disease, GI obstruction, and peptic ulcer disease. One thing to note about this drug is this supplement has been studied in the treatment of Alzheimer's disease at doses of 50 to 200 micrograms and has been found to be safe for short-term use in the clinical trials lasting between 1 and 3 months. While this supplement may sound like a good alternative for the treatment of Alzheimer's disease, the side effects and interaction with the disease states are something to consider. The next drug I'm going to be talking about is black cohosh. Black cohosh is derived from the Simicigi fuga racemosa plant. It is used to treat menopause symptoms or to induce labor in pregnant women. Some side effects include hepatic toxicity, which is also known as liver damage. This drug is a CYP2D6 inducer, which decreases the concentration of drugs such as codeine and metoprolol. Codeine is usually used for pain, and metoprolol is a heart medication. It's usually used for heart failure. Another thing to note is it has been found to be unsafe to use in patients who are pregnant or breastfeeding. So that concludes our short introductory presentation on herbals. Um, just some key take-home points from this presentation is this is not an all-encompassing list. There are still hundreds of herbal products out there. Things to know about herbal products are they may not be safe or work as well as they claim. Always do your research. The herbal products could have potentially serious side effects. They may interact with other medications like Ron and myself were talking about. They not they may not always be safe to use in certain conditions. And please, if you have any questions, consult your pharmacist. They are the medication experts. They will know if the herbal product is appropriate to use or not. Well, that's all we have for today. Thank you.